We are talking this morning with Dr. Jerome Paulson, who is with the American Academy of Pediatrics and is a specialist on children's environmental health. First of all, could you please explain the concept of children's environmental health?
It's important for legislators to recognize that children are not little adults. They have different behaviors, they have different physiology. When they're born, they're not finished. They need to continue to grow and develop. And it's all of those things taken together that means that they react differently to environmental hazards that they may encounter. And the other thing is they live longer than adults do. So if I'm exposed to something and it takes 40 years for the result of that exposure to occur, well, I hope I'm around 40 years from now. But if that happens in a 14-year-old, then they're going to be around if we do everything else right. So we need to take all of these factors into account when we legislate and regulate.
Are there particular media or particular issues where children are more vulnerable than adults that we should be paying attention to?
The vulnerability of children actually begins even before conception. There are things that can happen to the mom or the dad before they conceive that child that influence their sperm or their eggs, and then therefore influence the conception that occurs. Of course, while a child is in utero, that child is growing and developing extremely rapidly and therefore very vulnerable. Once a child is born, the brain, the lungs, the kidneys, the liver, all of the organ systems continue to grow and develop. And it's that growth and development that makes the children more vulnerable to things than adults are. So for example, the lungs need to grow during childhood. We know that kids who grow up in in an environment with more air pollution may end up with smaller lungs when they're 20 or 21 than kids growing up in a more pristine environment. Not so much smaller that they're sick, but what happens as in everybody the lungs deteriorate over time are those kids who grew up in a more polluted environment more likely to end up with emphysema or some other disease as an adult than a child or a young adult at 20 who had a greater reserve.
What have you seen as a pediatrician over the years, changes in children's health issues?
Well, thankfully, while we haven't solved the lead poisoning problem, we very clearly have improved the lead poisoning problem in that there are fewer kids with markedly elevated lead levels. We still need to focus on the buildings in which kids live and try and make sure that the buildings are safe so that they do not poison the children. So we still have work to do. On the other hand, we know a lot more about asthma, but yet asthma rates are still significant. And we know that air pollution, for example, can exacerbate asthma in those kids who already have the disease. So until we get a better handle on ozone and some of the other air pollutants, we are going to continue to have kids not be able to go to school, not be able to play, and if things get really bad, end up in the physician's office or the emergency department or hospitalized.
What about the environmental health standards that have been proposed and promulgated by EPA? Don't they take children into account?
We have to remember that Congress writes the laws that EPA follows, and EPA can only do what Congress gives it permission to do. And so over the last several decades, Congress has given the EPA more permission to take the special needs of children into effect, and they've done that in a very vigorous kind of a way where they've had the opportunity. So for example, under the auspices of the Food Quality Protection Act, the EPA can take some of the special needs of children into account when they review pesticides. On the other hand, the Toxic Substances Control Act has not been revised in any significant way since it was originally written in the 1970s. And with the mindset of the 1970s and the knowledge of the 1970s, the special needs of children were not taken into account by the Toxic Substances Control Act. And so we have a Toxic Substance Control Act which essentially does not control toxic substances as it relates to children, or I will also suggest as it relates to adults. And while EPA tries to be as protective of children as it can be within the constraints of the law, it can't do some of the things that it knows needs to be done unless and until that law is changed.
What are the three major themes you would like state legislators to know about children's environmental health?
The state legislators need to understand the special vulnerabilities of children when they write legislation and when they review the regulations that come out of the executive branch agencies. They can get input on that from the various pediatric environmental health specialty units that are in academic medical centers around the country. And if they go to www.pehsu.net, they can find all of these centers listed. They are all indirectly funded by the federal government, but the federal government doesn't tell us what to say. And we have no industry funding, so the industry doesn't tell us what to say. And so we can provide a science-based and otherwise unbiased review to the legislators as they contemplate the various problems that confront their states.